My name's Kathryn. Welcome to my proctology series, which is small clips about common anal conditions that you may see and be bothered by and may be too embarrassed to ask about. If you haven't watched any of my other videos before, my name's Kathryn McCarthy. I'm a colorectal surgeon in Bristol, and welcome to McCarthy Clinic HQ. I work both in the NHS and also privately. The clinic details are here. And today I'm going to talk to you about pilonidal disease. Now, for those of you that have never had pilonidal disease, you can consider yourself very blessed. For those of you that have, this is a whistle-stop tour, a little bit of background to the condition and the 4 important things to know about pilonidal disease. So pilonidal disease is essentially a boil or an infection in the natal cleft. Now, natal cleft are some of these terms we use in colorectal surgery that are a bit scary, that you don't hear normally in magazines or read about in newspapers. But it's basically the valley of the buttocks just above the anus, sort of on the back of the body. So if you were to imagine where the anus is, just directly above it is a sort of squashy area that becomes firmer with the coccyx bone underneath. And in most of us, that area, the natal cleft, is the valley of the buttocks, and it's probably 8 to 10 centimetres in most people. The common thing about all of our natal clefts is that we all have, it is a hair-bearing area, so we all have hair follicles there, and some of our natal clefts are deeper than others, particularly men. It's all down to the shape of the pelvis, the bony pelvis, but also the amount of obesity or visceral obesity, because some of us can have deeper areas and some of us can have jobs that mean we need to sit down quite a lot. Office workers, truck drivers, those sorts of jobs means that if we're sat on our tail ends the whole time, the area can be quite damp, which means that any infection in this area can be very difficult to treat. It is a condition that's a bit different to just a simple boil or pimple that you might have elsewhere in the body, that by squeezing it or lancing it can usually rectify the problem. That's unfortunately not the case in pilonidal disease. And the reason for it is there becomes a deep-seated infection underneath the little boils in the midline that can collect hair, and the hair can roll up like a bird's nest and become really quite smouldering in terms of producing sort of mucky fluid that's a bit malodorous. It doesn't look like bowel content, but it's got a funny smell, and it can erupt from now and again, from time to time, like a volcano, and can be really bothersome. And the reason why I want to do this video today is because I've had some patients recently where this has become the end of the world for them. It's difficult to treat, it never goes away, and it's very embarrassing to talk about. So I want to just dispel a few myths about this and make this as simple as possible. So the first of the 4 issues is that good hygiene is really important. Now, this condition, although it's an infection of hair follicles, is a bit different to an ingrown hair, which is what people who shave or hair remove, say bikini line, regularly can experience. This is a bit more deep-seated than that, and as a result, it's very important to keep the area nice and clean, to make sure the area is not too damp, and really maintain as good hygiene as possible down below. Cotton underpants, avoiding nylon, avoiding chemicals, antiseptics if necessary. The second thing to know is that you might need to attend the emergency department if you've got a problem down there. These little pussy areas can suddenly get much bigger very quickly. And if you've ever had a boil in that area and try to squeeze it, you'll know it's a very difficult area to access yourself and is incredibly painful. And that's because the nerves around the anus, which are essential for our continence, also mean that other conditions are felt more sensitively or more acutely than they are somewhere, say, for example, your arm or your elbow or your knee. And so you might need to go to A&E, and it might be that you need a lancing procedure. We call it incision and drainage. You will be aware that it's essentially lancing pus and giving it a good clean out. The frustrating thing about the emergency procedure is it is what it says on the tin. It lances an abscess, but it doesn't provide definitive treatment for pilonidal disease. So you might think, well, I went to A&E and I had it lanced and it's not gone or it's come back. And that's because an emergency procedure is not really the setting to deal with the deep-seated infection. And this is something that unfortunately needs to be done in a specialist clinic like mine or other colorectal surgeons. The third thing to say is hair removal. Now, for me in my practice in treating pilonidal disease, this has been a game changer. It's something that's not available on the NHS, so you have to either pay for it yourself or you have to apply for exceptional funding to get a course of laser hair removal. Now, not everyone is eligible for laser hair removal. Generally, you need to have dark hair and quite pale skin to have successful laser hair removal. So if you've got blonde hair or reddy, very light reddy hair, it's unlikely that laser hair removal will be appropriate for you. And so if you have those hair groups, I would definitely recommend other hair removal methods such as hair removal creams over the counter, epilators, a little bit sore, or going for a regular wax, which can last for up to 3 weeks. What I have found in my practice in the last few years when I have sent everybody for hair removal, be it home-based or laser-based, is that the need for surgery then diminishes. And the reason for that is that you are treating the root of the problem. And so laser hair removal is not really designed to treat the problem once you've got it, but it can certainly help in having recurrent symptoms, and in my own experience has really taken away a whole group of patients who I originally thought needed major surgery to actually, we can just do a small, quick cleanup job instead of removing bits of skin in that area. Which brings me on to the fourth option, which is my specialist interest, which is an operation for pilonidal disease. And if you put it in Google, there are many. And we are all divided in our countries, in our units, in our individual colorectal expertise as to what works best for us as surgeons and what we have seen good outcomes from. It can range from a small procedure where we clear out the bird's nest, clean with Savlon, and insert something like fibrin glue, which is essentially human superglue, to something little bit larger, excising a cleft of skin and all the tissues underneath that are infected, including the bird's nest. And the largest option, which is something called a Limburg flap, we remove a rhomboid of tissue, including all of the little boils and associated tracts, and we swing a flap of buttock over. In most centres, that's considered advanced and a plastic surgery procedure and not something that you would necessarily need straight off. It does, however, have excellent results. So I hope that's been helpful for you today, and if you need any more information about this or would like to come and see me, then don't hesitate, and the details will be found at the bottom. Thank you.